Welcome to this presentation on Color Doppler Ultrasonography in the third trimester of pregnancy significantly reclassifies fetal growth restriction in the Samrakshan Program of IRIA in India. This research was conducted by Matthew Choorakuttil et al. And published in 2023. Today, we will explore the key findings and contributions of this important work. Let's begin by understanding the problem this research addresses. Fetal growth restriction, or FGR, is when a baby in the womb does not grow as expected. These smaller fetuses are at a higher risk for complications like brain injury or even mortality. Doctors typically define FGR as when the estimated fetal weight is below the 10th percentile. However, FGR is not just about size. It also involves changes in blood flow as the fetus adapts to a potentially challenging environment. This study looked at pregnant women in their third trimester who participated in the Samrakshan program. Doctors used Doppler ultrasound to measure blood flow in specific areas of the fetus and mother. Key measurements included the uterine artery pulsatility index in the mother and the umbilical artery pulsatility index, middle cerebral artery Doppler waveforms, and cerebroplacental ratio in the fetus. The researchers analyzed data from over 4,000 pregnant women across 9 states in India. They found that roughly 7 of fetuses had an estimated fetal weight below the 3rd percentile, and about 13 were between the 3rd and 10th percentile. Notably, about 23 of the women had an abnormal Doppler study. The study showed that using Doppler ultrasound was useful in identifying FGR. Doppler study had a sensitivity of 73.1, meaning it correctly identified about 73 of fetuses with FGR. Without using Doppler assessments, doctors might classify all fetuses with an estimated fetal weight below the 10th percentile as having FGR. In this study, that would have been about 20 of the screened population. However, by adding Doppler information, they were able to reclassify some of these fetuses as SGI instead. In this study, the use of Doppler led to the reclassification of almost half of the initial FGR group. This research shows that using color Doppler ultrasonography in the third trimester of pregnancy can significantly improve the identification of FGR and SGI in India. By incorporating Doppler assessments, the Samrakshan program was able to reclassify a significant number of fetuses from FGR to SGI. This reclassification can lead to reduced healthcare costs, decreased rates of cesarean sections and preterm births, and improved outcomes for both mothers and babies.